We undertook this study because over the last decade, evidence has been growing that air pollution is having a massive impact on public health. And recent estimates show that air pollution is actually the leading environmental health risk factor globally, more than any other environmental cause of disease. And yet the leading global burden of disease assessments from the World Health Organization and the Institute for Health Metrics and Evaluation have only focused on a subset of the diseases that we know are impacted by air pollution. One of the diseases they hadn't yet incorporated was the impact of air pollution on asthma. And so we set out to try to understand what is the impact of air pollution worldwide on new cases of asthma among children worldwide, which is one of the strongest pieces of evidence that we have. Epidemiological evidence is mounting that nitrogen dioxide pollution in particular is linked with new onset asthma among children. And so we wanted to start incorporating that into the burden of disease assessments for air pollution. One of the key findings of the study was that nitrogen dioxide pollution has a really important impact on the number of children worldwide that are being diagnosed with asthma. And in fact, the largest impacts were seen in cities, where up to almost about 50% of new asthma cases among children in some cities worldwide were attributable to nitrogen dioxide pollution. I mean, that's just a really massive impact that traffic emissions and other sources of NO2, nitrogen dioxide, are having on children's health. Globally, we found that about 13% of asthma cases among children were attributable to nitrogen dioxide pollution, and that ranges up to about 50% in individual cities worldwide. Now, these are really preventable cases of asthma. These are children who did not need to be diagnosed with asthma, who are getting asthma because of their exposure to ambient air pollution. We can certainly be reducing their air pollution exposure so that children don't have to live with this disease, and parents don't have to see their children be diagnosed with this chronic disease. One of the ways to combat air pollution exposure is really the key way is to reduce burning of fossil fuels. Burning fossil fuels leads to both air pollution and greenhouse gases. And in fact, one of the things that we found in our study was that cities that had higher nitrogen dioxide levels also had higher greenhouse gases. And so one thing that can be done would be to avoid burning fossil fuels, reduce it in any way we can. We certainly don't need fossil fuels to power our cities in the future. We can design cities in a much better way. We can design them around electrifying mass transit. We can design them around active commuting, so people have more access to trails so that they can cycle and bike and walk and run to work. And so there are many ways to improve access for people to be able to more easily avoid burning fossil fuels. Yeah, so we found that areas with high nitrogen dioxide concentrations also had high greenhouse gas emissions. And this is really because burning fossil fuels releases both air pollution and greenhouse gases. And so historically, we have addressed some air pollution in some ways in some parts of the world, and we have not yet addressed greenhouse gases. NO2 is not one of the air pollutants that appears to have declined to the same degree as some other air pollutants like particulate matter. And so we're seeing this situation here where we have areas with both high NO2 concentrations and large greenhouse gas emissions. And these are areas that could actually be achieving what we think of as co-benefits or multiple societal benefits by avoiding burning fossil fuels. They can both bring down their air pollution, reduce their greenhouse gas emissions, improve health for their citizens, and really allow their population to live healthier, greener lives.
So we estimated that between 2010 to 2015, around 4 million children worldwide developed asthma each year due to exposure to nitrogen dioxide pollution, which primarily come from traffic emissions. On a national level, the highest burdens were found for China, India, and the United States. And we focused on 125 most populated cities worldwide, and we found that the contribution of nitrogen dioxide pollution exceeded 20% in 92 cities located in both developed and developing countries. Yeah, so worldwide, the cities with the highest percentage of NO2 attributable pediatric asthma incidence were found for 8 cities located in China, and followed by Moscow in Russia and Seoul in South Korea. So we found that this is also a problem in US cities, with the highest NO2 attributable burdens occurring in 5 cities that are New York, LA, Chicago, Milwaukee, and Las Vegas. And within these cities, the percentage of NO2 attributable pediatric asthma incidence ranges from between 27 to 38%, whereas the highest values in cities worldwide were found for Shanghai in China for 48%. And so this suggests that we're seeing high exposures to nitrogen dioxide pollution in cities worldwide. So one of the more surprising findings for us was that actually over 90% of NO2-related pediatric asthma incidents occurred in areas that already met the World Health Organization guideline for annual average nitrogen dioxide pollution of 21 parts per billion. And so if nitrogen dioxide proves to be the causative agent of asthma incidents within the traffic pollution mixture, this suggests that this WHO guideline may need to be reevaluated. Yeah, so a lot of the epidemiological studies that have tried to look at the effects of traffic pollution and new onset asthma in children have commonly relied on nitrogen dioxide as a marker for the complex traffic pollution mixture that can be composed of hundreds of gases and particles. But it's still inconclusive whether nitrogen dioxide is specifically the causative agent. And so future studies that can tease out the particular chemicals within the toxic traffic pollution mixture will help us to understand better the sort of chemicals to be targeted from traffic emissions.